अगर आप भी हेल्थ के बारे में जानना चाहते हैं तो सब्सक्राइब करिए मेरा ये चैनल डॉक्टर एजुकेशन और बेल का आइकन दबाइए ताकि आप आने वाले हर वीडियो का नोटिफिकेशन सबसे पहले पाएं।
Hi everyone, I'm Dr. Paramjeet and you're watching Dr. Education. Today we are going to talk about food cravings. Do you know that food can put a damper on stressful feelings? Though the effect is temporary, but yes, eating tasty food can actually put a damper, can reduce your stress and your sadness. Many of you must have experienced that. Foods high in fat, sugar and salt can be more appealing when you are under stress or are in a bad mood or feeling bad about yourself. Emotional eating often becomes a habit. That's why if you have used food to soothe yourself in the past, you may crave candy or potato chips, cold drinks anytime you feel bad. The next time you are upset, it becomes even harder to say no. So everyone has a bad day, but not everyone uses food to get through them. Some behaviors, some thought patterns can increase your chances to become an emotional eater. So if you have trouble managing your emotions, you may be more likely to use food for that purpose. Being unhappy with your body may make you more prone to emotional eating. This goes for both men and women. Dieting. Yes, dieting can put you at risk. If you feel deprived of food, you may be frustrated and tempted to emotionally eat whatever you like the most. So these things can actually make you a food addict, can have food cravings and ultimately lead to increased weight, and you feel that you have no control over yourselves. So this is actually food craving. Guys, this is not actually a disease. This is a psychological dependence. This is a psychological disorder. Disease is where you are out of ease. Disorder is when your normal life order is disturbed. So this is not a disease, it's a disorder. You are not sick. All you need is to train your mind. So let's see what all you can do. Most important is to observe yourself. Pay attention to your eating patterns and the people or event that make you want to overeat. Think about it. Do you eat when you feel angry, depressed, hurt, or otherwise upset? Do you eat in response to certain people or certain situations? Do certain places or time of day trigger food cravings for you? All these questions needs to be answered whether you have certain specific triggers for food cravings. You have to pay attention to all these things so that you can find out specific trigger points. Now, what you can do to cope with these things? You have to try and develop new coping skills. The next time you want to use food for emotional therapy, think about how else you might deal with the situation, how else you might deal with the feelings that trigger that urge. Let me give you some options. You can take a class or read a book on managing stress, or for that matter, any book you like, any topic you like. You might talk about your feelings with a close friend or a family member. You can go out on a walk to clear your head. Your emotions might just lose their force with time and space. So you can just wait. Give yourself something else to think about, like a hobby, a puzzle, a good book. Just music can work. Exercise can work. Value yourself. Getting in touch with your values, strength can help you manage bad times without overeating. Write about things you care deeply and why they matter to you. This may include your family, social cause, religion, or even a sports team. So anything you like, write about it. And why do you like it? Think about it. Write about it. Writing helps. Write about things you have done that make you proud. Spend time doing things you are good at. All these things can actually divert your mind. Plus, eat slowly. Emotional eating often means you eat mindlessly and lose track of how much you've taken in. Make yourself slow down and pay attention to the food you are eating. Put down the fork between the bites. Take a moment. Taste your food before swallowing. If you indulge in something like cookies, fried chicken, limit the portion down. Eat less amount of those things, of junk food. Do not eat in front of the TV or computer. It is too easy. It is absolutely inevident to overeat when you are distracted by what's on the screen in front of you. Plan ahead. If you know a difficult or stressful time is coming, set yourself up for a healthy eating in advance. You can chop vegetables for salads, make a pot of broth-based soup ahead of time so that you have hassle-free, filling meals waiting for you. Do not go hungry. Do not go hungry when you are both hungry and stressed. Pizza and other fast food become much more tempting. Stock your kitchen with healthy snacks like salads, fruits, vegetables. Look for ways to prepare your favorite dishes with fewer calories. Use skimmed milk instead of whole milk or cream of milk. Use 2 egg whites instead of 1 whole egg. Replace half the butter with applesauce when baking. Use cooking sprays instead of oil or butter for cooking. You need to go to a doctor and discuss your problem if you have symptoms of binge eating disorder. What are those symptoms? If you lose control, if you often lose control while eating, if you eat to the point of discomfort, if you feel shame about your body or about your eating habits, and 4, if you make yourself vomit, often make yourself vomit after eating. So if you have these symptoms, then you should go talk to a doctor. You might be having a binge eating disorder and may need psychological counseling and some medications. So everything is curable if you understand it properly. So food cravings are manageable. All you need is a willpower. Where there is a will, there is a way. This is Dr. Paramjeet. If you have any questions, do write about it. And don't forget to subscribe my channel if you haven't subscribed it already. And if you have not yet, click the bell icon, then do that. That is how you'll get the notification for the next video. Make sure to follow our channel, spread this channel, share the videos. Thank you so much for watching.